Give the general characteristics, symptoms, and sign treatment, post-mortem appearance, medico-legal aspect of poisoning by mineral acid and a strong alkali. Mineral acid and strong alkalis are a corrosive poison. In dilute solution, they act as a irritant. The symptoms and signs of the group are as a whole are very similar. Their action is mainly on local one of the tissues of the alimentary tract and to some extent on the respiratory tract. As a rule, there is no remote systemic action with the exception of shock. Their action is characterized by extraction of water from the tissues, coagulation of cellular proteins, and conversion of hemoglobin into hematin. General symptoms and signs. The onset of symptoms is immediate soon after swallowing the poison. There is burning sensation in the mouth, throat, esophagus, stomach, abdomen, followed by intense thirst, difficulty in swallowing, continuous retching, and vomiting of shreddy blood-stained material. The vomit may be acidic or alkaline nature depending upon the substance taken. There are signs of corrosion of the mouth, lips, and both. Tongue is usually swollen and shriveled according to the nature of corroding agent. With the ingestion of corrosive acid, the bowels tend to constipated and the urine scanty, but with the alkalis there may be tenesmus, frequency of stools with the blood and mucus. Traces of poison may be also find their way into the trachea and be followed by respiratory tract symptoms. Dyspnea is often present from edema of the glottis and is more marked in the volatile and strong fuming fluid. Collapse from shock sets in with a cold, clammy skin, pale, anxious face, sunken eyes, dilated pupil, rapid, feeble pulse, sighing respiration. Consciousness is usually retained until near the end. Death of result from primary shock. Suffocation due to edema of the glottis or perforation of the stomach if the quantity of the poison swallowed is small. Death may be delayed until hypostatic pneumonia develops. The patient may recover and death may ensure later from complications such as strictures of the esophagus with the resulting emaciation and malnutrition. The sites likely to be affected by local contact and the early later delayed effect of corrosives are shown 39.1. The sites of action and elements of corrosive sites likely to be affected by local contact is a skin, face, or elsewhere. Mouth and throat, upper alimentary tract, and respiratory tract. Early effect pain and shock, vomiting, and dyspnea due to respiratory obstruction from laryngeal edema. Late effect perforation of the stomach, pulmonary edema, bronchopneumonia. Delayed effect esophageal pyloric pyloric stricture, laryngeal stricture, pulmonary fibrosis. Treatment: stomach wash and emetics are contraindicated. Emetics and stomach wash are contraindicated. However, a soft stomach tube or living tube can be passed with care within about half an hour of the ingestion of the poison to prevent a serious caustic burns of the stomach wall followed by ulceration, contraction, and even stricture. If an acid has been taken, alkaline carbonate are contraindicated. Weak alkalis and plenty of water on the neutralizing agents such as milk, egg, albumin should be given. In case of alkali, a weak acid such as vinegar will neutralize its effect. Morphine by injection is necessary to relieve the pain. Ice to suck to relieve thirst. Intravenous fluid to combat fluid loss. A corticosteroid for shock to prevent the esophageal strictures. Tracheostomy may be necessary if there is acute edema of the glottis. The other treatment is along the lines indicated for general treatment of poisoning. Post-mortem appearance, there may be expressed as generalized signs of corrosion and partial destruction of the part with the poison has been contact. Externally, lips may be burned or trickle. Markers may be found running from the mouth to the chin, neck, and chest. Internally, they vary in extent from localized patch to extensive areas, particularly in stomach. Perforation of the stomach is common with the sulfuric acid. Irritation of the respiratory tract is found in case of volatile poison. Nitric acid and hydrochloric acid. Medico-legal aspects. Attempted suicide with corrosive is not seen now, owing to largely to the use of other less painful substances like barbiturate, synthetic narcotic organophorus for compound. Corrosives are rarely used for homicide owing to their painful action. They are sometimes thrown on the face out of the jealousy on a fits of rage. This is known as vitriolage. They cause severe injury or even death from accident spilling. Vitriolage. This means throwing of any corrosive, not necessarily sulfuric acid, on a person with a malicious intent out of jealousy, hatred, or begins to seek revenge. The facial disfigurement of the face is due to throwing of sulfuric acid by some out of the malice. Injuries characterized by corrosive stains on the skin and trickled markers. In this case, eyes are spared permanent discoloration of face and results in grievous hurt. These fluids are usually thrown on the face with the object of destroying vision or causing facial disfigurement and result in grievous hurt. Sulfuric acid oil of vitriol is most commonly employed for this purpose and hence it is called vitriolage. Nitric and carbolic acid are sometimes used. Use of caustic soda, caustic potash, iodine, and marking nutta juice have also been recorded. Sulfuric acid produces severe chemical burn. They are characterized by discoloration and staining of the skin and clothing brown or black sulfuric acid and yellow nitric acid, trickle markers, absence of desiccation and red line of demarcation and the presence of the chemical substance in the stain. Immediate treatment consists of washing away the corrosive acid with a large amount of water, soap or a dilute solution of potassium or sodium bicarbonate. Later, a thick paste of magnesium oxide is applied. The raw surface may afterward be covered with the antibiotic ointment. When the eyes are involved, they should be washed at once with a large amount of water, followed by irrigation with 1% solution of sodium bicarbonate. A few drops of olive oil are then instilled into the eyes. Eye drops containing antibiotics and steroid may be helpful. Acid attack have been on the increase. Consequently, in a separate section in the law, for punishment, in this case, rigorous and punishment up to 7 years is recommended. Acid attack. What is acid attack? What is punishment? Attack is throwing or attempting to throw acids or an acid substance or with a corrosive burning nature which can cause a bodily injury leading to scar or disfigurement or temporary or permanent disability or disgrievous to that person. Punishment range from 5 to 7 to 10 years to life imprisonment and fine depending upon the gravity of the case, which is paid to victim as a compensation. IPC 326A and 326B. Thank you.